we do know we have a huge health workforce crisis and shortage in terms of when one looks at the demographic trends and looks at the numbers of health workers that are going to be available in the coming years.
The key question that we need to ask ourselves is really around how the limited number of doctors, nurses, community health workers that we do have are spending their time, right? And what can we do to increase the amount of time that they have available to interact with the patients, to provide that in-depth, compassionate care that patients deserve.
Now these new large language models which allow us to talk to machines in a very natural way. We had hospitals that went paperless, so we digitized, but can we go from paperless to keyboardless? Can we eliminate the keyboard as a form factor so we talk to machines? And I think the technology is there.
We're going to see an explosion of new tools, new platforms, new solutions coming out every day. The question is, which one of these tools claims to provide health care, health advice, help to support clinicians or providers in their delivery of care? And it's where the risk and the closeness to patients require a regulatory oversight that we need to be carefully paying attention to those technologies to ensure that they are safe, they are confidential, they are dealing with patient privacy, and that they're not putting people at risk.